All right, everybody, doing a special update tonight, a little break from the pod. But if you guys don't know, if you don't follow the channel, hit that subscribe button right now to the Hoops Rehab Show. I am the Game Injury Doc, aka Dr. Evan Jeffries. I'm the co-host of the Hoops Rehab Show. It is a podcast that is live on YouTube, and we also have the podcast on anywhere you get your podcasts. So I wanted to come on here today to give a little description, a little background of the Stephen Curry knee injury. He's been out since, I think his last game was January 30th. And so he's missed the last 5 games. And he also missed All-Star break with a knee injury. They've been calling it patellofemoral pain syndrome. This is characterized as what we call runner's knee. So essentially, it's a repetitive injury. People that are obviously runners, the knee starts to get irritated and you start to have pain in the front of the knee. So essentially, if you think about where your knee is, here's the femur bone, and you have your patella that sits on top there. And so the irritation is in between the patella and the knee bone. So essentially, what Stephen Curry is kind of going through is just inflammation, irritation, which is causing him an issue of trying to play on it, trying to run on it, trying to jump on it, and he needed rest. The problem is, however, Steve Kerr seemed to think he would be coming back this week after having at least about 2.5 weeks of rest there. But in today's practice, they're supposed to have a scrimmage. He told the coaches he was not ready to return. His knee didn't feel right. They have no update on the timeline now, and they're going to possibly do an MRI tomorrow and kind of update everybody as we go. As you know, the way the NBA works now, 65 games to get any of the all NBA awards or any of the season awards are causing havoc on this league, kind of causing pressure on players to kind of return a little bit earlier than they should. In his case, he can only essentially miss one more game. So you got to know that it's probably pretty serious if he's still missing games, and they got about 27, 28 games to go in the regular season. They're currently sitting in 8th place. I think they're 29 and 26. So it's becoming crunch time for them. And they also traded for Kristaps Porzingis, and he is possibly going to play on Friday. He's been dealing with his own issues, which is POTS, which is an issue that he's been dealing with since last season with the Celtics and with Atlanta this year. And that's postural orthostatic tachycardia syndrome. So essentially, he gets up, feels lightheaded, faint. His heart rate will increase like crazy. And sometimes he has good days, sometimes he has bad days. But hoping for the best for him. But going back to Steph Curry, what makes this diagnosis a little bit difficult to kind of treat, and then also it can be that there's a lot of differential diagnoses with this injury, and that's probably why he's getting an MRI. There's a couple diagnoses that kind of come to mind that mimic what they would call this patellofemoral syndrome pain. And one would be maybe they had an MRI before and they missed a meniscus tear. So it could be your lateral meniscus. It could also be your medial meniscus. But essentially, you could be having anterior knee pain, and it could feel similar to this. You may have had a very, very small tear that may turn into a little bit of big tear. They might have missed it on an MRI. Remember, an MRI is slices of an image. There are times where in an MRI that it can actually miss it. So I think they're going to go back in and double check if they missed anything there. A meniscus tear would obviously be concerning. It'd be something that he would likely would need more time off, number one. Number two, it'd be something that he could possibly have to have surgery with. So we wouldn't want to jump the gun and go straight there, but that is a possibility. There's also a diagnosis called fat pad syndrome. So essentially, underneath that kneecap, the patella, there's a pad that kind of stays there, right? So it's called your infrapatella pad. And at times it can be irritated, it can be inflamed, and it can really mimic that runner's knee. And so that's something that he would likely need more rest. There are some times where they can do like a PRP to kind of speed up the healing process, but it also restart the inflammatory process. So he would need to go through those stages of healing, which would probably take a couple more weeks. Now, another thing he could be having, and this is something because Steph is getting up there in the league, he's 37, 38, has been playing a long time in this league, 17 years, I believe. And it could be chondromalacia. So essentially what that is on the thigh bone, the femur, there's a articular cartilage that lays on there to kind of protect the bone. And then you got the patella and you got the bone there, and then you got the pads in between. And essentially that cartilage could be wearing. And so that's essentially not old age, but it's something that happens to people as they age or as they have been in a sport that they've had repetitive loading. And Steph, he's the guy that runs the most miles in the league. He's constantly going around the court. And the thing about when you have knee pain, when something like that is happening, it makes it so difficult to perform your activity, to continue the rate that he plays the game at. And when he feels pain, it's something serious, because he does not like to miss games. And the last 2 years, he's done a really good job of staying on the court. Obviously, last year in the playoffs, he had a hamstring injury, his first one ever, which obviously knocked him out of the playoffs. And it's not something that he would want to do or have to do. So, unfortunately, there could be some differential diagnoses going on with this injury. And I think that's why they have to do the MRI. If it were my guess, either they missed a meniscus tear, and that could be possibly causing some of this pain since his knee hasn't responded well to the treatment and also just taking time off. And then also he could just have more of that arthritis, that chondromalacia, which is he's having irritation on the articular cartilage there. So either way, we're going to keep you updated here at the Hoops Rehab. Eric B. Mack, we're always on here twice a week, sometimes 3 times a week. We will also go live occasionally when there's especially a specific injury or specific things going on in the NBA. But again, if you're watching this YouTube video right now, hit that like button, hit that subscribe button. Also drop a comment, and then we will get back to you. And we like to add a lot of those comments to the show. So when we are doing the show, we're going to be talking about the NBA. We're talking about all the drama, and then we're always keeping everybody updated on the injuries. So as soon as I find out something about Steph Curry, I will be back on here to update you guys even further. But until then, I'm Evan, and the Hoops Rehab team is out. Peace out, guys.